Hi, welcome back. Today let's talk about vaginal bleeding in pregnancy. It's a very common thing, but you're not supposed to have bleeding. But it's okay. Most of the people who have had bleeding will go on to deliver normal, healthy babies. It is few people that we are worried about, but we want to check into it. It's very, very common in the first 3 months. Later on, it may not be that common. Let's find out what are the reasons for this kind of bleeding so you know when and how to get help and not get panicked. First trimester, that is the up to 12 weeks or the 3 months, first 3 months. What happens in the first 3 months? First 3 months there could be a number of reasons. Most common ones we are worried about is miscarriage. Is it because of miscarriage? But most of the times, as I said, it is not because of that. It could very well be because the pregnancy is elsewhere. That is called ectopic pregnancy. Or it could be because molar pregnancy, that's a problem in the placenta with such kind of pregnancy. And sometimes it could very well be because there is something wrong or inflammation in the neck of the womb. It's nothing to do with the womb at all. Sometimes it could just very well be an implantation bleed, which is very, very normal. It normally happens around 10 to 14 days after the conception. So these are the reasons for first pregnancy bleeding. How about the second pregnancy bleeding? It could be because the neck of the womb or the cervix is not very competent to hold the pregnancy. It is opening up and hence there could be a bleed. It could still be a miscarriage. It could be because the placenta is coming away. It could be because you're going into labor early. Or it could be a problem with the neck of the womb again, called cervix. It could be an inflammation or any problem there. Or very, very rarely, if you have had a previous cesarean section, it could be or a surgery for fibroid or something. Then it could be that that part of the womb is not holding the pregnancy and it could be rupturing. Sorry, I didn't tell you. I only said second trimester. What is second trimester? Second trimester is after the 12 weeks or after the third month till 24 weeks. Okay, that is almost 6 weeks, 6 months time. Okay. So that is the cause for bleeding in the second trimester or 3 to 6 months. What about the third trimester? That is from 25 weeks onwards. So most of the times we say it is because you're going into labor that you might start seeing blood there. Going into labor in the sense that it's most of the times it is old blood or the flush blood with a lot of mucus. That's how it is. That's how we know it is you're going into labor. Sometimes it may not be. If you're near the term, then yes, you can call us up and ask us. If not, then we do still need you to come to hospital. What are the other reasons? It could be that placenta is coming away again, you are going into preterm labor. It could be that the placenta is covering the cervix or the neck of the womb and that is separating, and that's why you're getting painless bleeding at that time. So many reasons, and also that your womb is not holding and rupturing or opening up where you've had a cesarean section or another scar because of another surgery. So these are all the reasons in the third trimester. Third trimester and the second trimester reasons are very, very similar. Only difference is third trimester, most of the times it is because you're going into labor more than the other causes. The other causes we would have diagnosed by the time you come to us, most of the times, like placenta previa and things like that. That's the only difference. When to see us? So in early pregnancy, if it is a little bit of spotting only and no bleeding and the spotting stops in a day, yes, you need to inform me, but there is no emergency or urgency. But however, if you're having pain and as well as bleeding, little more than spotting, and it is continuing after a few hours, then yes, you need to see you immediately to see if you are miscarrying or if there is any other problems. What do we do when you come to us during these stages? We want to see why you're having these kind of bleeding. Okay, so we may ask you to do your scan to see what's happening, and we may ask you to do some blood tests. Why do we need the blood test? We need to know what blood group you are. If you're positive, it's okay. If you're negative, then we want to know what your blood group of your husband. If he is also negative, it's okay. If he is positive, however, you may need injections called anti-D injections. We will talk about this more in another video because it will take a longer time. And then take it from there. And depending on how much of bleeding you have had and the reports from that, we will decide whether we can just don't have to worry about it, or do we have to worry about it, or do we have to admit you and watch. And what about the second trimester or after 12 weeks? After 13 weeks to 24 weeks, we would say any bleeding, you do need to come to the doctor sooner rather than later, especially if it is painful and more than spotting, then we would say as an urgent. If it is painless and more than spotting also, it is very urgent that you do come. So even in the middle of the night, yes. So what do we do at that time? Yes, we will look at your 20-week scan, that is the 5-month scan, to see where your placenta was, and we will examine you to see how your stomach is, whether it is very tender to touch, very hard, and we will check your baby at the same time and see how the baby's heartbeat is, and depending on, and some blood tests to do. If we are able to do the scanning at the same time, yes, we would love to do the scanning as well. But these are the basics which will be done even in the middle of the night. It can be done. So once these things are done, we will take a decision and we will explain to you why it might have happened and how to go about it. And in the third trimester again, as I said, most of the times it is because it's towards the end of your pregnancy, you're getting into labor, early labor, which is all perfectly fine. It might be soon after we have done what is called as membrane sweep, wherein we separate your baby's water bag from your womb to help you get into labor by yourself. So it could be after that. But as I said, most of the times when you're going into labor, the bleeding can be sometimes old or sometimes fresh, but most of the times with mucus plug or mucus inside it, that we call it as shoe. Okay. Any other bleeding, yes, we are concerned.